It's always nice when you can go on location and get to know the people in your own backyard. And joining me today here at the Southwest College of Naturopathic Medicine is Dr. Forrest Beck. Good morning to you. It's nice for me to come out here because I have to tell you, this facility is impressive. And you just drive up and down the street, you have no idea what's going on in here. So tell us about opioids. Now, the broad spectrum is, and I got some facts here, 259 million prescriptions were written for opioid pain meds in 2012. That's the broad spectrum, but you were saying in Arizona alone, it's still pretty high.
Yeah, in the last 5 years, the number of deaths from opioid overdoses has doubled. So, you know, the other thing about opioids that's really important to know is they don't discriminate. They affect young or old, black or white, wealthy or poor. And they can have a devastating consequence or devastating effect on individuals depending on how often they're being prescribed and how much they're actually taking of them. And they can just rip people's lives apart. So at the Pain Relief Center, we have a lot of other options that we provide for solutions to those issues.
Well, let's talk about an overview of what you do here at the Pain Center, because it's pretty impressive the type of things that you have available for individuals. So what are some of the things that you do treat when it comes to those specific needs of an individual that happens to come here?
Yeah, well, we have non-surgical options, treatment options that range anywhere from using acupuncture and cupping to injection therapies. Those injection therapies could be regenerative in nature. So regenerative medicine includes prolotherapy, neuroprolotherapy, stem cells, platelet-rich plasma, those types of things where we're using the body's own stem cells, own substances to actually provoke a healing response and allow the body to heal. And that can be anything from arthritis that we treat to injuries from playing sports, or injuries just from taking a wrong step as you're walking off a step if you're an elderly person, and that happens a lot. So we cover the gamut with the number of things we offer and the types of populations that we serve.
Now, you are a very unique facility, but some people still have that mental mindset, I got to go see my traditional doctor. So how do you get them to take and consider your facility and what you do here versus going the traditional medicine route?
That's a good question. Many times they have seen the traditional doctor and they have had steroid injections, they've had surgeries, but they are frustrated at the amount of pain that they are still in and the fact that they don't have good solutions. Maybe they're not good surgical candidates. So it really is a matter of not wanting to do another surgery, knowing that they have a limited number of steroid injections that they can do before they start to see a lot of side effects. So it's really appealing to have natural solutions where we don't have the long list of side effects that typically would be present with those other treatment options. And cost is generally a big issue for a lot of people too. Right. We're talking multiple thousands of dollars, tens of thousands of dollars to do surgeries. And the price point is really appealing for a lot of individuals regardless of your financial situation.
And speaking of the individuals that you do treat, when they come here, they have a specific plan that's designed for them uniquely and their needs, which is a little bit different. It's not the basic gamut that everybody's going to get the same drug because you have a similar, symptom.
Yeah, it's cookie cutters approaches do not work well when it comes to patient care. That's our doctor's job, is to assess the patient, come up with a treatment plan based on their individual needs, and then talk about what the best therapy is. Is it something really low level like acupuncture, or do we do something a little bit more complicated or complex like the regenerative medicine?
And you also have, we got 1 minute now to wrap it up, you have lifestyle modifications. So if someone is in need of help of diet and nutrition, they can get that as well. And you also treat eating disorders.
Yes, we do. Lifestyle factors are essential. You can't really just focus on a person's pain if the things that they are eating are increasing inflammation in their body, are causing more pain for them. So that has to be part of the puzzle, and that's one thing naturopathic doctors are really good at doing, is looking at the whole person. So what they're eating, how much exercise, how much movement they have in their day, what type of stress they're under, and how we can modify that stress to kind of calm them and decrease how they handle their pain.
It's one of those things, like I said, it's right here in the Valley. A lot of people pass right by it, but the Southwest College of Naturopathic Medicine is a place you need to discover in case you are looking for that alternative to something different. Dr. Beck, you are fantastic. Thanks for having Arizona Daily Mix out here to talk to you.
Thanks so much, Danielle. Thanks for being with us.
you.